Hello, doctor.
How are you? How are you, Sean?
I'm good. How you doing?
Yes. Nice to speak to you again. It's been a while.
Good. Thanks for coming on to Offline Utmostt review.
Nice. Wonderful.
It's been a interesting journey so far for you guys. What I can see and what you've been doing.
Yes.
Good. Could you please introduce yourself to everyone and what the whole concept of your organization is all about?
Sure, definitely. Hi, everyone. How are you doing? My name is Nana Yaw Appiah. I am one of the co-founders of Brain Project. We are an NGO that started here in the U.S., but our aim is Africa. My co-founder is from Cameroon. I'm from Ghana. And the whole purpose was that we want to be able to go back as Africans in the healthcare field and give back and not just leave it up to always having to watch others go to Africa and help our fellow brothers and sisters. It's an organization that kind of came about because, we would always sit around and talk about how we wanted to help the continent. And we figured enough talking. You just need to do something. And so we got started 3 years ago in January. And we've been pretty active since then. We've done missions to, 2 to Cameroon, 1 to Ghana. And we had a couple more planned in this year, hopefully. Well, we had 1 more planned this year and 1 in January. However, we're obviously held back by the pandemic that's currently affecting the entire globe. So our goal is to go back and not just provide healthcare, but we also want to exchange knowledge. We feel that's the biggest role that we can provide because of the benefit we had of growing up here in the U.S., educating in the U.S., and we benefited from, such a great educational system, just a great country. So education is that first core, that first tenet to making a better society, and in medicine, at least ensuring better patient care and outcomes.
Fantastic. Well, I'll just a little bit about how we met. And, it's got us. So in December, about Nation, Ghana. I was out there doing completely different kind of work. And in the hospital, I met Dr. Tables were beside each other, and asked me, who are you? And that's how we started talking, and he told me what he did, tell him about that. And it was very, very interesting because I started talking about what the project was all about. Wanting to know more and see how we help. As Africans, if they have to work, like is it rightly said, we speak of things that are not right for our country, but in little ways, in some ways, we're not able to help, we're doing enough. So when I see people doing this kind of thing, I'm very, very happy about it, and I like to support. So I'm going to go on to the next question.
All right.
How did the name Brain Project Africa come about?
Oh, that's a very good question. We initially had a bigger vision. Our vision really was to start a foundation, and we called it the Future of Africa Foundation. And we thought our idea was we have expertise in healthcare. We have friends that have expertise in.
A couple of people are complaining about the feedback. I'm not sure why is that. Can you hear me very well, Doctor?
Yes, I can hear you on my end.
Okay.
Perfect.
Does it sound accurate? Does it sound well? Is it smooth?
Oh, I can. Yes, there's an echo from your end. Yes.
Okay. What about now? Can you hear me now? Is it better?
Yeah, it's better now.
Okay. Okay, they said it's better now. Yeah, I can see that. So sorry, yeah, go on.
Sure. So we, like I was saying, our goal initially was to start a broader organization where we would provide expertise in healthcare. We have friends that are engineers; they would come and bring their expertise, and then we have those that are in other fields. So we wanted to start one big foundation, and then tap all our friends who are leaders in those fields to head that segment. But to be honest, it was just too big of an undertaking. Uh, and Brain Project just really made sense. We have experience and expertise in neurosurgery, and the brain is actually an acronym that allows us to bring resources and infrastructure and other things to the continent. So we figured, that just makes better sense. Let's just focus on our core competency, do what we do best, and then there are so many other bright minds that can handle the other parts without us having to dilute ourselves.
Okay, fantastic. Boss, could you tell us what your career?
Yes. So I have a background in research science, so I do clinical trials and I set up those clinical trials for major pharmaceutical corporations. I also have obviously the clinic that my partner and I run, which is a neurosurgery clinic here in Texas. He's a neurosurgeon, and I do most anything research related in the clinic. So currently we have a couple of clinical trials going on in the practice, and he operates. I stick with the books.
Okay, fantastic. Fantastic. So how many people of the organization, or what's the structure like?
Okay, so the structure, obviously you have the board of directors, and then you have, I guess if you go back, you have myself and my partner who are the co-founders. We have the board of directors. We have a managing director in New York. His name is Kwejo Yaboah. He has a consultancy background. He's worked for the big consultants in the U.S., like KPMG and the rest. And then we have volunteer doctors here in the States. That number, I think the last count, we were almost at over 90 or so physicians now. Yeah, that volunteer, and they go on different missions depending on how it fits their schedule. So that's how it looks here in the U.S., which is the hub for the Brain Project. Now, overseas, we have branches that are opening soon, but we have active members there as well. For instance, in Switzerland, we have our head of social media development, and also the head of the branch there in Switzerland. And then in Canada, we have the same. We have a neurosurgeon there that's also opening up a branch. And then in Germany as well. So we're branching out and allowing a lot of our colleagues who want to take the lead to open affiliates of Brain Projects or subsidiaries there. And the goal is to grow it and then hopefully have a bigger organization in the end.
Okay. Why Africa?
Oh, Africa's home. It's home for everybody, right? In particular, it's home to us. And it's easy for us to forget home. We were lucky. I say we as in my partner and I, we had strong families that really pushed us to never forget home. And any one of my friends that know me will tell you I'm constantly talking about home and I'm talking about Africa because it means so much to me. So I think Africa was just the obvious choice. Charity, as they say, begins at home, right?
Oh, fantastic. I mean, one of the intriguing things to me, when we met was that we actually met in an environment where, sorry, I'm not sure what this is connected. Can you hear me? Is it still
I can hear you. Yeah, it comes out in and out a little bit, but I can hear you.
Okay. So we met in an environment where Africa was being celebrated. I have to commend Ghana for how they, sort of in proclaiming Africa and Ghana, how they were able to attract a lot of people in the diaspora On the plane from Lagos to Accra, I met so many people that came from the US. They're going to Ghana from Lagos to go and be part of celebrations going on. I found the affirmation as well there. I met a lot of people from the States, people I didn't know from the UK, from Europe, and from all over the world. So it was a good celebration of African culture. I'm happy that's how we got to meet. And you may not understand the impact you're making, or you may not struggling for words here. I'm trying to. I know you're doing your job, but when you look at it in just a nutshell, it's so empowering. It's a really, really good thing you're doing out there. I haven't come from Africa myself. I was born in Lagos. For, I did my secondary school, a bit of university in Nigeria, so I came to the UK. So I know what we're like. And as Africans, when you look at the population of Africans in diaspora that actually medical doctors, people of high intellect, innovation, ideas that within the diaspora that in Europe, America, and all parts of the world, you often hear it so sad to use that word. Why we're still lacking behind in such areas. So I'd just like to say this, right now, thank you very much.
Well, thanks.
Most of the plans for whichever way you can so that the word can be out there. Someone said it's gone back again. Let me see. I'm not really thinking but I'm not sure. Can you hear me?
Yeah, I think it's better when you move closer to the camera.
Yeah. Is it better this way?
Yeah, that's better.
Then, okay. Is it better now?
Much better.
Okay, much better. So, like I was saying, it's really, really, it's a great privilege to talk to you and to get the insights about all these things so that people know, because we actually want people to know what you're doing and how they can reach out. Somebody said that the phone mic is bouncing off. This person is tech. Is a techie. Is it better this way?
Yeah, it's better this way. I hear it much clearer now.
But I can still hear a bit of. Hello, can you hear me? Okay, so I'll go on with what we're saying. So I have a couple of questions here for you. How do you fund this great organization? How do you fund it?
Well, yeah. So the organization is currently self-funded for the most part. It's my buddy and myself, and then we have some friends that have stepped up tremendously, right? So we have obviously donors that have pitched or raised small events here in the States and also in Switzerland. And in Ghana, for instance, we had some help from some of the banks as well. But for the most part, the large majority of the bills are footed internally. And we want to change that because we want to leverage so many in the diaspora and also back home that realize the importance of healthcare. Hopefully they feel the same way you do. We've been championing this cause for years, and obviously the global pandemic has brought this our point home. Is that, we feel that we have the African doctors in the diaspora. A lot of them want to go back and contribute, whether it's once a year, every couple of months, or some wants to even move there. However, there is not the same reception back home. So what we really have been pushing is that we've done our part in getting the healthcare providers here, whether African or not. We have a lot of healthcare providers that want to go back. So we need the funding, we need the government support to be able to make or close that gap and make that a realization. Because right now, if you're in Lagos, if you're in Accra, I mean, if you're in anywhere in Africa and you want to go, let's say to London to get treatment, or you want to go to Belgium to get treatment for COVID-19, you can't. They're not going to allow you to get on a plane and go get treatment. So it is about time that Africans take care of Africa. They just need to do it. It's common sense. It doesn't make any sense that we always have to be waiting for others to come do stuff. It's not saying that there's anything wrong with that. We all need help. But and I have some friends that always obviously get annoyed when I start talking about the responsibility of Africans, because I feel so passionate about it that we can't sit on the sidelines, because when situations like this happen, we should be the first to respond. We shouldn't have to wait for everyone to solve. Right now, if we're waiting, let's say, for Europe to fix the pandemic and America to fix the pandemic and then come take care of Africa, that's nonsense. That should not happen. So I really appreciate this platform. I know I haven't had a chance to thank you for inviting me here. I hope that those that hear this can help us grow the organization. We even have a lot of subgroups that are formed in with doctors from different African countries, because our goal is to go to all 54 countries in Africa. So we have my WhatsApp. As you know, sometimes you text me, it's hard for me to get back right away because my phone is ringing off the hook. We have a Nigerian group of doctors right now that started a couple of weeks ago, and they are up to like 50 something members, and everyone is just always chiming in, and is wonderful. It really is great. So really, thank you for this opportunity.
That's okay. The main thing is we we are utmost we're very, very passionate, like I said earlier on, about the development of Africa and people in the ethnic minority within the diaspora. So we have to take a responsibility to help each other. And the good thing is we have a lot of people that are very, very innovative, like I said earlier, and people like yourself, whether that be it in the health sector, whether that be it, in terms of policy. I mean, people that are well traveled, people that understand how economy should be, how welfare should be, should be sort of distributed among citizens of each countries. But we just need to come together more.
Correct.
We need to come together more, and I feel every little platform to sort of gather and to encourage each other, we have to explore it.
100%.
So, I mean, when you told me that, in December last year, I had different ideas, but I was taking my time to actually look at the more effective ways to do it. And I've already started that. So we're going to set up a couple of interviews for you through the media in Africa, here in the UK, and even in America where you are, and then we're going to look for organizations that can partner with yourselves. So, because resources come in different forms. It's not just monetary. You need people with bright ideas.
100%.
People that can open doors, people that can speak to government, people that can, you need foot soldiers, you need champions. And I think some of the problems we have where we're trying to do things in Africa is sometimes I feel there's a sort of, maybe I can call it lack of communication.
Yes.
The people back home, because often the time when people have tried to go and do things, they're met with like brick walls, So I think these are the issues we need to look into as well. We need people that can liaise between, the helpers and the people who need the help. So, we have to keep talking. It's a conversation that has to keep going on. But I'm very, very positive that at some point we can make a difference.
I agree.
Next question. Yeah, go on. Sorry.
No, go ahead. Next question. Yeah.
So how many countries have you been to, and do you have an idea of how many people because I know you do surgeries. I'm not sure if that's the only thing you do. How many countries in Africa have you been to?
So right now we've been to 2 countries, and we've done 3 missions in those 2 countries in 3 years.
Okay.
We had a couple of other trips planned for Ethiopia and Senegal that are still in line. I think it's going to have to come when all this calms down, obviously. But yes, we have a lineup from Ethiopia, Senegal, Mozambique, Angola, obviously Ghana, and then Morocco. I think will come online as well. So definitely, I think our goal is to hit every single African country, and then hopefully have multiple missions going on at the same time. And in order to get that, we have to reach that that critical mass where we're on autopilot, and I think we're getting there.
Okay, brilliant, brilliant. What are some of the challenges you face?
I mean, some of the challenges, obviously, is the typical African challenges that we all know about, right? It's bureaucracy is difficult to work through. It's difficult to plan a time and do something punctually in Africa, as we all know. We have a different way of moving on the continent as opposed to the way we do in the West. But for me, I embrace it, and I try to really allow those that go with us to embrace it and not get too frustrated. Because just as we want to go and learn, and we want to go and share what we know, we also want to learn as much as we can from our brothers and sisters on the continent. And one thing we know is that um, some things, you can take time to do, and other things you need to hurry. Obviously, if you're in the operating room, you need to be in a rush to do certain things. However, outside of the OR, you have to be able to enjoy the normal patterns of life. And I think that one of the big has been the punctuality, and the other has been the bureaucracy, I would have to say.